Hey everybody, I decided to kind of do another video. I guess I haven't quite realized that I didn't give you all any kind of background on kind of where I came from, how I got to this point. So I just kind of want to give you guys hopefully as short of a story if I could possibly give you. It kind of started out in high school. I always noticed that, when I was running and playing sports that, I always had a lot of joint pain and back pain and, things that I didn't feel like the other people around me were dealing with. I felt like, I kind of felt like I was the only one going through this crazy amount of pain. So anyways, I blew out my knees and everything a lot. I went to college, played volleyball at West Georgia, and I started blowing out my knees a lot then too, and I had ended up having a knee surgery shortly after I quit playing volleyball, and they repaired my meniscus, and they found out that I had a lot of inflamed tissue in my knee, so they ripped all of it out. It ended up being a very long recovery, and during that process they sent out the tissue to I guess to do a biopsy, and it came back positive for rheumatoid arthritis. So at that point they sent me to a rheumatologist. A rheumatologist diagnosed me with lupus. The next rheumatologist, I got a second opinion, diagnosed me with fibromyalgia. I've heard diagnosis after diagnosis. I have lupus, and I also have touches of things that appear to be fibromyalgia, very sensitivity to, in my skin. I have a little 3-pound cat. She walks across my legs and it feels like a Doberman, or a, pit bull is dragging themselves across my legs. It hurts that bad. So I've got a lot of that kind of sensitivity. Well, starting out, my pain wasn't quite as bad. It was more of, I was sick all the time. I felt like the lupus, caused me to get the flu a lot. It caused me to have a lot of joint pain. And I had a lot of pain, but it was pain I was able to deal with every day. Then recently, within the last few years, the pain has kind of gotten to the point where it's not bearable. It's not something that I can handle day in and day out. So started on lots of different treatments. When I was 19, I got put on steroids. I was on them off and on for a while. I didn't like them because they made me gain weight. Needless to say, I've gained about 85 pounds. I've also adapted high blood pressure and some body dysmorphia even, and some very unique marks that people think are stretch marks. They're not. It's from the steroids. It kind of like eats you from the inside out. And so I've got these hideous marks on my body and all this weight that I've gained from this lupus, and from mostly the steroids. So I would say anybody that has to take prednisone, oral steroids, to be very careful. Don't make it a long-term thing, because the long-term, there's just too many bad side effects for the long-term of that. So whatever you do, try to stay away from steroids if you have any kind of medical issues. Anyways, years down the road, I can't handle the pain. I got put on, Lortabs, basically just low hydrocodone. Then next thing you know, that wasn't working. So we kind of upped it up to some higher dose hydrocodone, or Vicodin, then Percocet 5s, and Percocet 10s, Percocet 10 650, which is the highest dose of Percocet and Tylenol mix. And then it became morphine. And then it was morphine 30 milligrams extended release, that would last over a 12-period hour time. And then it didn't last that long. And then it became morphine 30 milligram immediate release. Getting it all immediately and taking it every 4 to 6 hours. And that's no longer enough. So the pain just couldn't be cured, which is why I'm where I'm at now, of trying to come off this medication so that I can try other medications that don't just mask the pain but treat me as a patient. So basically that was kind of how I got here. I could go into a lot more depth And I could do that on a one-on-one basis, but just to give everybody an idea of kind of where this came from and how this happened, that's basically it, So if you have any questions, let me know. I'm actually leaving work now. I'm just now starting to experience some detox pain. I feel like more anxiety, pain, irritability, forgetfulness, a little hazy. But besides that, it's not that bad right now. So I'm going to hurry up and get home so I'm safe and hopefully be able to handle this. So thank you for everybody, your comments, people with the private messages. I appreciate that tremendously. It's things like that keep me going, and I hope you guys keep sending the private messages, keep sending the comments. I like that everybody's helping me get this out there. I appreciate that. Share with your friends. I don't mind. I just think that stuff like this that we go through, other people should know about it, that other people go through it, and that you can do it. You just gotta, I guess, stop making excuses and do it. So, anyways, everybody have a good day, and hopefully I will touch base with you all later.